Away from educational matters, back here in Lagos, the First Lady of the state, Dr. Ibijoke Sanwo-Olu, has harped on the need for stronger government collaboration in the campaign against the measles and rubella virus. She was speaking during a courtesy visit to Governor Babajide Sanwo-Olu for support at the Lagos House, Ikeja. Details in this report.
In the spread of Measles-Rubella virus explains why the First Lady of Lagos State, Dr. Ibijoke Sanwo-Olu, is on a support mission to Mr. Governor. The advocacy is part of renewed nationwide efforts to protect children and families from the threat of Measles-Rubella virus. Dr. Ibijoke Sanwo-Olu says both viruses are preventable through vaccination, yet still pose risks in vulnerable communities.
We're taking a big risk because a lot of our children are not being covered by that, and a lot of our pregnant women too. The effect of that is if they miss that, if they ever end up having rubella infection, then the child might become blind, deaf, or have delayed mental milestones. There has to be more coverage for the whole of Nigeria. Lagos having a very high population, and so the campaign is going to start very soon. Sensitization has started in some states. We want to start the one in Lagos State, and who needs Lagos State support.
Governor Sanwo-Olu, while responding, commends the state and national primary health care boards for their proactive strategies, expressing his administration's full support for the campaign.
Today's campaign meeting, it's very critical. I would not claim to have an vaguest idea of what rubella is, but I've taken it on that all of you as professionals, you know what it is. Rubella measles, like it's been called, or measles-rubella. I can imagine it's a very, very serious vaccination that we need to take very seriously. How do we now plan? What level of advocacy, what level of community engagement we need to have before they think that is something else that we're going to give people. So that's why I understand and I appreciate that even as government, we can't do it alone. We have to work with partners, we have to work with professionals, we have to work with people that know, what needs to be said, how it has to be said, and what kind of community engagement needs to happen. Because like he said, the success of any campaign is the outcome. We've got a lot of input, but it's the outcome. And the outcome is to ensure that the population we're seeking to target, we can reach them. That will be. And once that coverage is done, then going forward in terms of ensuring that we just keep with the heads, then it makes it a lot easier.
With the vaccination exercise scheduled to begin in Lagos by January 2026, officials believe the campaign will strengthen Nigeria's path towards a virus-free society.